John is a Purdue University and University of Illinois alumni. He started his career in Chicago Public Schools and later in his career started a private practice that grew into a national speech-language pathology agency which specialized in bilingual speech-language pathology. John currently is the founder and CEO of LinguaHealth and the bilingual SLP resource grupalingua.com. John, tell me about how you became interested in speech-language pathology.
When I was an undergrad at Purdue University, I took ASL as an elective course. Many of my peers were studying speech-language pathology, and I started learning about the profession of speech-language pathology. Since it was a profession where you actually got to help people and work with languages, it seemed like a perfect match for me. So I decided to change my majors and start studying speech-language pathology.
Apart from studying speech-language pathology, did you pursue any other activities that helped you learn about our profession?
When I was home from my studies in the summer, I decided to work at Camp Sign, a camp that was funded by the Chicago Hearing Society for children that were deaf that needed some extra activities during the summer. During that volunteer experience in summer camp, I learned about deafness, I learned about hearing aids, I learned about poverty, I learned about how working with children with disabilities can be actually quite fulfilling. And it became really a great experience for me in my future career as a speech-language pathologist.
Those sound like valuable experiences. Were there any others that helped you in our profession?
I really never had any experience working with disabled children or adults. And so as an undergrad, I decided to seek out opportunities to work with this population. Essentially, I stumbled upon this program called respite work, where you could work with children or adults with disabilities and help them by taking care of them when their parents needed to go out and do something else for themselves. It was kind of like a sitter situation where we were the primary caregivers. A lot of these children and adults had medical issues and they couldn't just be left with anybody, so there was some training involved. I learned a lot about disabilities at that point. I learned a lot about how important it is to involve families in actually the service delivery for therapy. I learned how there are so many things that parents have to do related to their child's education or just taking care of them that affected therapy models. This was something I was unfamiliar with before, and it actually, I think, made me become a better speech-language pathologist.
Those sound like really valuable experiences. How did they affect you?
Well, in some ways, being a young college kid, you get humbled by experiences like that. You learn that maybe things for other people can be challenging, and you have to use those experiences to become a better person or become a better clinician. And that's what I really strive to do, is to learn from that experience and not necessarily say that, we're the clinicians and we're giving so much to this population. In some ways, in order to work with populations of children with disabilities, adults with disabilities, we have to be on the same level, and we have to open up the scope of what our perspective is on their situation. I know that when I was a clinician, we always thought speech therapy was the most important part of the service delivery model, but you also have to think about physical therapists, you have to think about occupational therapists, you have to think about medical conditions, and you also have to think that the parents, they have to coordinate all this. So this is it's challenging, but I think for me for me personally, I learned that there are many facets to being a speech-language pathologist, and in some ways you have to step back and look at the whole picture sometimes to be a better clinician.
Well, thanks for sharing these valuable experiences that help shape your drive for our profession.
Thank you, Carrie.